I'd like to introduce you to our webinar today, which is Finding Help with Your Vision, and it's going to be presented by Nabill Jacob, who's a Clinical Relationship Manager at Vision Australia. So Nabill has held posts of Senior Orthoptist at St Vincent's Hospital in Sydney and Corneal Transplant Coordinator at the SaveSight Institute at the Sydney Eye Hospital. His interests lie in the advancement of services and clinical understanding in the area of low vision and blindness. He has also published low vision case studies and in medical and orthoptic journals. Nabill is currently on the steering committee of the New South Wales Health Department Agency for Clinical Innovation, a project developing a resource for staff at public hospitals to enhance their understanding of the needs and treatment of patients who are vision impaired. So thank you so much, Nabill, for joining us, and I can't wait to listen to your webinar.
Thank you very much for having me, and to everybody out there, thank you very much for joining. As I've been introduced, my name is Nabill, and I've been with Vision Australia on and off for a few years now. And my role here primarily is to be able to disseminate the information about what to actually do when you have an eye problem or your vision is low. And in the context of today, it's the macular disease is the primary cause of your vision loss. And what are the sorts of things that we can do to help you? You're already with a fantastic organisation such as the MDF, and you're getting expert advice and information and follow-up. But with regard to the practical things, you know, how do I cook? How do I still walk around safely? How do I get dressed, organise my kitchen, my bathroom, my day-to-day activities? We're going to talk a little bit about that today. Okay, so a little bit about Vision Australia. Some of you may or may not know us. Our most famous, I think, accolade is Carols by Candlelight every Christmas. We're the leading national provider of blindness and low vision services in Australia. We spread right across the country with about 28 offices. We work with people of all ages and stages of life, so it's not just young people or older people, it's everybody. So we have about 27,000 clients on our database. We've worked with about 3,000 of those right through from birth, right through schooling, adolescence, work, study, into the rest of their lives. So we can follow people throughout their journey in life. We work in partnership with you and your practitioners and your families, carers, to work out what it is that you actually want to do. What is your vision condition stopping you from doing that you really love to do and want to be able to continue to do? So that's where we'll come in and find out what it is you want to do. And you may want to do something today, and that may change in a year's time or 6 months' time, and we will change with you. So you might achieve one goal. So I want to be able to cook at home. We'll teach you how to cook. Okay, I want to be able to go down to the pub, have something to eat, and get there safely and get home safely, and we'll teach you that. So we'll follow you through your goals and your desires. So the way we do that is we focus on independence, employment, if you're working or still need to work or want to work, education, do you want to study, do you want to continue your studies, are you working but no longer can do your job because of your vision loss, do you need to retrain, we'll help you with all of that. And social inclusion, how do I maintain my social life and how do I stay connected to what's happening out there in the world, use my equipment, my devices, and you'll see some pictures there. So from very basic, teaching somebody how to catch a train, to a new tablet where you can check your email, check the internet, very easy, very large symbols and toggles, right through to magnifying, still being able to read, and there are a myriad of types of equipment that you can choose here at Vision Australia, because we also do have retail areas where you can trial the equipment and see what's right for you. So today what we're trying to bring across or put across to you is a little bit of an introduction about Vision Australia and the services we provide and what's available to you. Understand your vision loss a little bit more and just know about the supports and when and how to refer yourself or to seek help from Vision Australia. So let's talk a little bit about vision. A lot of you have seen this classic vision chart. Just to explain it in a little bit more detail. So you see where the 6/6 is, or some of you may be aware of the 20/20 which is exactly the same thing as 6'6". So the Americans use 20 as in feet, and we use 6 as in 6 meters. So you'll see there that that's the normal driving line. You can still see 2 lines less than that and still get your driver's license. So your vision can still be pretty good and functional, even if you don't have what we call normal vision. And anything below that 612, right up to that top large letter at the top of the chart, that starts to indicate low vision, moderate to severe. And then if all you can see with both eyes open, with your latest glasses prescription is the top letter, you are legally blind. And that can go beyond to the point where you can perhaps count somebody's fingers if they're about 10 centimeters away from your face, or just see a hand waving in front of you, or even just noticing when it's light or dark. So vision can be classified in different ways, way beyond the vision chart. I hope that's clear. We also check vision, not just by what you can see, what your detailed vision is, but also with your side vision, your peripheral field. So you may be able to see that 20/20 or 6/6 normal vision line, but if your visual field is so constricted, sort of like looking through 2 toilet paper rolls, you can also be considered legally blind if that constriction is less than 20 degrees. So that's another way of classifying when somebody is blind or can't see for legal reasons. And of course, you can also have very decreased central vision and decreased peripheral vision at the same time. So some of the common eye conditions that we see here at Vision Australia and that you've heard about, the classic one, and that's why we're all here today, is age-related macular degeneration. And you'll see that picture there that's a little bit enlarged. Comparing it to the normal vision picture on the left, you can see that the central part of that, things have gone a bit blurry. And that's probably start stages of macular degeneration. And that can go right through to having just a black patch in your eye where you can't at all make out someone's face or read or watch TV or do those finer detailed activities. We also deal with diabetic retinopathy, and that causes little bleeds at the back of the eye, at the retina. And as you can see from that picture, it starts to cause like checkerboard vision. Then there's glaucoma, as we all know, and that's a high pressure in the eye. The eye has an inflow-outflow mechanism of water, and sometimes that can become blocked or for whatever reason starts to increase in pressure, and that pressure puts pressure on the back of the eye, where the nerve comes in from the brain, the optic nerve. And the way that presents itself is your side vision starts to disappear. And usually the vision that you've lost at that point is pretty much gone, but there's lots of ways that your doctor can save what you've got left. Then there's other type of disease, retinitis pigmentosa, and that is another peripheral field situation, and that usually affects people when they're in their early teens, but progresses until they're in their early 20s. And these people, their visual field or their side vision constricts almost down to looking through 2 straws. It can get that bad, and their night vision suffers. So it's a really debilitating disease. And of course, cataracts, we've all heard about cataracts. It's the lens inside the eye, it becomes cloudy. If we all lived long enough, we'd get cataracts, and it's just a part of life. And as we all know, they're very easily operated on. But Vision Australia can also support people in that situation if they're on a waiting list for 18 months, 12 months, and their cataract is advanced and it's blocking their vision and stopping them from doing things or being safe. We can still help them in that interim period before their surgery. So visual impairment is common in older people. So unfortunately, as we age, our vision tends to decrease, and that's reflected pretty much in our client base as well here at Vision Australia. And while we see newborn children and toddlers, over 70% of the people we see here are over 65 to 70 years of age. There's about 575,000 people in Australia who are blind or have low vision. And it's really important to remember when we're talking about blindness and low vision that less than 10% of people are what you might call totally black blind. Over 90% have some sort of vision, whether they see light or a hand movement. And even if they only see light, that slither of light can be really important to somebody who's vision impaired, because if they're in a dark bedroom at night and they can see the light from the corridor slither under their door, that immediately orientates them and they know where they are in their room. So even if you have really poor vision, it's still very, very important to hang on to that. And that's where your doctor is super important, and your optometrist, in making sure that whatever vision you've got left is kept there and is maintained as much as possible. So very, very important to keep seeing your doctor and your optometrist. So some statistics, so the types of eye diseases and how many people have these in Australia. So there are about 7.2 million of us who are long-sighted, and that means we see clearly in the distance. And then we have people who are short-sighted, so we see clearer up close. Then we have people with astigmatism, and I know a lot of you have heard of that, but don't necessarily understand it. And what it is basically is the front part of the eye that does a lot of focusing, the cornea, is more shaped like a rugby league football as opposed to a perfectly spherical basketball or soccer ball. And glasses or laser can help with those top three situations. Presbyopia, once again, an unfortunate part of aging. The lens inside the eye isn't as flexible as it used to be when you were younger, so it can't bend or become more convex to focus things up close. So what you start to need, and usually this hits around the age of 40, you start to need reading glasses to do that focusing for you. So it's not a disease per se, it's just an aging process, and nothing to be concerned about. And for those people who are very, very short-sighted, they tend to go a lot longer or even without reading glasses. For the optical reasons I won't go into today. Then you have people who are colorblind, cataract, and as you can see there in red, 236,600 people in Australia living with macular degeneration. So it's quite significant out there. And about 130,000 people with other types of blindness. So the blindness can also come from the brain at the back of the eye. That's very common in young children. So the eye is probably okay, but it's the brain that does the interpretation that's not working properly. And unfortunately, females suffer eye conditions more than males do, as you can see down there, 59 to 51%. So the common things that might affect somebody with vision loss, and you might have a partner, a family member, a grandparent, a child, they may not be communicating it, but you may notice that they have these sorts of issues. So photophobia, which is just a fancy term for glare. So that can be an issue for some people with low vision, and that might mean cataracts, for example. They might have fluctuation in vision, which means one day their vision is blurry, one day it's clear, and it keeps going up and down. That could be an indication of diabetes. We don't know, but that tends to happen with diabetics. Decreased central vision, and I'm sure a lot of you are aware of this with the macular degeneration. You just notice your central vision, your clear or fine vision is starting to decrease. So you can't read, watch TV and do things like that. Your side vision or your peripheral vision might start to decrease. Glaucoma is a good example of that. And if it decreases too much, you start to bump into things because you can't see things coming in from the side. It's also another one to remember is judgment of depth or distance. So you might have one eye only, or had an accident and lost one eye, or you might have vision in one eye that reads the top of the vision chart and vision in the other eye that reads pretty good, down towards the bottom, towards normal. And the brain tries to put those on top of each other to interpret an image. And that can be very disconcerting if one's blurry and one's clear. So that can also cause problems for people judging depth and distance. But fortunately, the brain can adapt, especially if you've lost one eye and you can't tell depth and distance. Maybe at home you're okay because you're familiar with your territory. But if you were to walk out after losing one eye, for example, it's really, really hard to judge a step. But the brain fortunately does come around within 3 to 6 months and starts to adapt to that. So you're able to do that again. And of course, there's poor adaptation to changes in lighting or night blindness, and retinitis pigmentosa was a good example of that. So they're the sorts of things that can happen with people, who are suffering vision impairment of some sort. So vision impairments are very, very important. And I know a lot of you out there may be suffering from a vision impairment or macular disease. It affects people in different ways. Some people cope better than others, and other people don't cope so well. The important thing is to remember is there is support. The Macular Disease Foundation is your best friend in this situation. And when they see fit, or your doctor sees fit, or you want to move on and start doing more practical things, we're also here to support you. to be able to achieve the goals that you want to. But just remember, it's okay. Everyone experiences it in a different way, and that's what we find here at Vision Australia, and we'll work through that with you as well. So the sorts of everyday things, and I've spoken about this a little bit already, how does central vision impact my day-to-day life? Or how is, my grandmother, she's been diagnosed with macular degeneration. So what are the sorts of things she can actually see and can't see? And sometimes this confuses people because they can still use their side vision. So to somebody who doesn't really understand their eye disease, they say, well, they're still seeing, but then they tell me they can't see. So for them, it's going to be their detailed vision. So picking up a book or a newspaper, trying to chop up a salad or vegetables to make a meal, putting makeup on or shaving, watching TV, looking at someone's face on TV. Driving becomes very, very difficult. Even doing simple things like picking up your phone or turning on the laptop to surf the internet become very, very difficult. So the things that a sighted person may take for granted start to become a really big problem for people who have lost their central vision. And for people who've lost their side vision, these are the sorts of things that tend to be affected, and they're more outdoorsy things like, I'm not confident to catch a bus because I can't see to the sides, or I want to continue working or studying, but it's just too hard to get out and go to a lecture theatre or go to my office or to the factory or wherever else it is because I just can't see well anymore. I want to go down to the pub and watch a footy game with my mates or go down and play bingo, but I'm too scared because last week I bumped into 3 people, tripped over a dog, my meat pie went everywhere. So then you might start to see people becoming a little bit isolated because they're just too afraid to leave the house. They may have played sport, netball, soccer, and clearly that becomes an issue for them, so they stop doing that. Work, they can't work anymore, and of course driving's affected by side loss. So they can affect people with central field loss as well, but just to sort of divide them up in terms of what generally affects people with side or visual field loss as opposed to central vision loss. So things that you and I take for granted if we're sighted become a real big task for somebody with vision loss. The other very important thing to remember is as people age, we're already at risk of lots of things because of the aging process. If you have vision loss, on top of that, you're twice as likely to fall. You're 3 times more likely to fall into depression, and that definitely does extend all the way through to some people are suicidal, and we get a couple of those a year at Vision Australia where we fast-track them and help them through their journey. And it's another area that Macular Degeneration Foundation can be really, really helpful in. You're 4 to 8 times more likely to break a joint or a hip if you fall, and you're 3 to 5 years more likely to enter assisted living or a nursing home than you otherwise would have been. So you can see, for no other reason, seeking help is super, super important for those reasons alone. So how does Vision Australia help, you might ask me? What are the sorts of things you can help me with? You can see there are 12 little symbols there with a little description underneath. So we have a suite of 12 services where we can practically help you do most of the things that you want to do. And whether that's emotional support, you want to join a woodwork group, a cooking class, a crafts class, you want to play sport. We work very closely with Blind Sports Australia. We can accredit people for the Paralympic Games with regard to their vision. A few of our orthoptists are certified to do that. So there should be nothing there stopping you from coming together with other people or helping us to help you stay connected and stay social. Our occupational therapists who will help you at home with activities of daily living, so cooking, cleaning, managing your wardrobe, your pantry, your bathroom, your laundry. Is the house safe? Do I have any hazards here? Lighting, do I need any modifications at home that are going to make my home situation safer? Mobility specialists, so they'll help you use a cane, help you leave the house, get to the supermarket, the newsagent, a place of worship, school, and making sure that you navigate your area safely. I know a lot of you may have some vision, and as I said, over 90% of people have some vision, and they're not totally black blind. But even if you don't need that cane in a familiar environment, that may be a godsend for you when you're in, say, Central Station or in an airport or an unfamiliar, very crowded situation. If you just pull out your cane, and a lot of them are concertina, can be folded up and put away. If you just pull out a cane, that immediately indicates to people that you have a vision impairment, and people will give you some room, and it'll make you a little bit more confident to move around in that area, and even offer you support or advice if you need it in that situation. So never discount the power of a cane. Crossing a road, indicating to drivers you can't see, so they'll give you a bit more time. So it's a really fantastic tool to have, even if your vision's still pretty good, but when you're in an unfamiliar environment, you're a bit iffy. Our orthoptists, who will look at your functional vision. So what is it that you can actually see and do in day-to-day life? What is it that you can read, manage in the kitchen? So very practically adapting what vision you have to what you can do, and letting the rest of the team understand what it is that you actually can and can't see, and in what situation you can see it. So sometimes lighting is great, or most times it's great for people who can't see well, but for some people, too much light can start to be a negative. So the orthoptist is able to work in that area. We can help re-educate you, employ with regard to changing your skills if you need to because of your vision loss. If you want to study, if you need to seek a new job, we'll help you find that new job. So that's a fantastic area. As I said, we've got our aids and equipment, so you can come into a Vision Australia store, trial, feel, handle, all sorts of types of equipment. Our technology people will sit down with you and help you use the accessibility features on your computer, your phone, so that you're not at any disadvantage instead of staying in contact with your loved ones or watching the news or doing all sorts of things that you can do on your electronic equipment, such as your laptop and iPads. Early intervention, as I said, we have a specialist team that work with newborns and adolescents. At this point, I'll clarify something. So you've heard of guide dogs, you've heard of Vision Australia, and you might be asking me, well, what's the difference? Guide dogs are another fantastic organisation that work with people who are blind or vision impaired and help them with their day-to-day lives. And they have guide dogs. So at Vision Australia, we call our dogs seeing eye dogs. So there are 2 points where you can access a dog if you reach that level with regard to needing one. You can join our library, so you can download thousands and thousands of publications via audio, a Wi-Fi enabled device, or you can download an app onto your smartphone, and you've got from Mills and Boons to the Sydney Morning Herald, you can download all of that and it will actually be read out to you. We've also got Braille books, large print books, so the library is a really fantastic resource which you can join for free at a certain level of vision. And of course, helpful information and advice, the sorts of things that I'm doing with you guys now. And also when it comes to My Aged Care or NDIS, we have an expert team of people who will sit down with you and make sure that you have the best possible application or plan forward so that you can access all the services and all the aids and the equipment that you might need and receive the eligible funding that you're entitled to for that. So we'll take all of the complication out of that for you as well. So I hope that gives you a really good understanding of the types of services that we can provide. Putting that into a more practical term, so how would you help me with my blindness or my low vision, I hear you say? So what we're going to do is focus on 3 things. We're either going to try and enhance the vision that you've got left, so make that better. We're going to substitute, use substitution aids and equipment and therapy that's going to make up for that loss in vision. So we're using other things like your other senses like touch and hearing. We'll rely on those a lot more. Or we'll adapt your environment. So we'll change your office around, your home around to make it a lot easier. And those pictures down there will show you very clearly how we actually put those into practice. So we'll teach you how to get in and out of the car without bumping your head. The picture below the taxi cab one there is one of our orientation mobility specialists teaching the university student how to catch the bus to university, navigate from the bus stop to home. Below that, you can see a lady in her kitchen. She's got a talking microwave, a large timer there, contrasting measuring cups, a black glove against the white wall. So we'll work with you. You can see that her under cabinet is all lit up. So we can work with you to make sure that you're in the best possible situation. To a young lady there doing her office work with very enlarged 2 screens there, she can still do her work as long as it's at a certain size that she can see. An electronic magnifier, which you can put in your handbag and you can read your medicine tablet. You can take shopping with you to read ingredients, use by dates. You can take to a restaurant to read a menu. You can even use it to read a form guide, and that, you know, is a fantastic piece of equipment that comes in different sizes. Right down to the very bottom there, where you see the cup and the mug with that yellow plastic thing hanging over it. We'll even teach you how to make a cup of tea without burning yourself. So that yellow device will actually buzz when the water gets to the top of the cup, and it'll buzz again when you put milk in, if you like putting milk in, as well as vibrate. So you're more than happy and to get up and make your own cup of tea without having to rely on other people and starting to fend for yourself. On the right-hand side, you'll see technology. So that the iris vision that gentleman has on, that goggles that says iris vision. So that's a fantastic tool. And what that does, it actually magnifies. So if you've got macular degeneration and your central vision is gone, you know you can still see from the side of your eye, but it's not as clear or as acute. What something like the iris vision will do is enlarge that side vision to the point you can actually start making detail out. So recognizing faces. If you're in a woodwork class, you can look down and see what it is you're doing or cooking. That's a real life picture of a gentleman with macular degeneration, and he's actually using them to watch his grandson play soccer on a field. So he can actually enlarge the picture in front of him to the point where he can actually make out his grandson. Just below that, on the pair of black glasses, that pen-like thing on the side arm of the glasses, that's what we call an AllCam. That's amazing new technology, and that'll do things like recognize faces. If someone walks into the room, it'll read for you, tell you the color of something, tell you the time of day. It'll even read a barcode if you're at the supermarket, and it'll tell you what that product is, the size, and the ingredients. And it'll also read things at the supermarket. So fantastic piece of equipment. And below that, you'll see the gentleman with the phone in his hand, and he's downloaded the library app. And you can see the forward, backward play button there. Very easy, very simple. And he's got that wherever he goes. So they're just some of the practical ways that we can help people keep going on with their lives and not miss out on doing the things that they love to do. So at Vision Australia, the services all come together. We integrate them. We have lots and lots of different specialities. And by far, we often find if you come in for one thing, you're going to end up needing at least 2 or 3 different types of services. So please rest assured that Vision Australia can pretty much take care of everything. So other than probably giving you back your driver's license, we can pretty much help you with every other aspect of your life to make sure that you're happy and your goals are met. So with those 7 circles there and the specialists involved in those areas, we help you live the life you choose. And that's our motto. And that's what we do every day at Vision Australia, is helping people live the life that they choose. So I'm going to give you a quick example of a lady with macular degeneration, and you'll see the picture to the right there of what Valerie actually sees. So Valerie's a 70-year-old lady, and she's come to Vision Australia being diagnosed with macular degeneration, and she sat down with us and said to us, I want to continue on with my life, and there are things I want to keep doing, and I don't want to have to rely on other people. I'm otherwise fit and healthy. So we sat down with Valerie and we worked out what are the goals that you want to be able to achieve? What are the things you want to do that you can't do? So she told us she'd like to have a dog guide. And just so you're aware, to further confuse the situation, there's guide dogs, there's Seeing Eye Dogs Australia, but the actual official or generic term is dog guide. So there you go. You've learned something today, if nothing else that I've said. So we were able to help her out with that. She told us she'd still like to be able to read. She loved reading. She told us she'd like to be able to go shopping, but she was having a hard time looking at ingredients and identifying things on the shelf at the supermarket. Sometimes the lighting wasn't very good. She wanted to still be able to use her phone and her computer. You know, they're very important parts of most people's lives these days. She wanted to be able to cook and, maintain health and maintain that she was taking care of herself very well and eat healthy and learn new skills how to do that without hurting herself, cutting herself, or burning herself. And she wanted to stay social. She still wanted to go out and play bingo. She still wanted to be able to go out and dance and do all sorts of things. So we sat down with her and we were able to help her achieve those goals. So she was allocated a Seeing Eye dog. She also got help from the orientation mobility instructor with a cane. She joined our library and has now got talking books and large print library. So remember, she can still read very large print with the side vision. She was able to see the orthoptist who helped her with lighting and magnification to take around with her. So whether that's a traditional magnifying glass with a light in it or an electronic one that I showed you in the picture before. She worked with our adaptive technology specialist who sat with Valerie and worked through with her how to use her computer and her phone very simply. There are lots and lots of accessibility features built into lots of electronic equipment these days for people who don't see well or may have other disabilities. So it's just a matter of going through those and learning how to use your phone or your computer differently very successfully. She saw our occupational therapist who made sure that her home was safe. She was safe in getting around. She was able to cook, manage her pantry, and do all sorts of things that she otherwise would have had difficulty in doing. She also joined a woodwork program and other day programs that we offer, which vary throughout the year. So you can see very basic needs, things that a sighted person may take for granted, and we were able to help Valerie do them, albeit in a different way. So referral. So when do I come to Vision Australia? How do I refer myself? How do I refer my grandmother or my uncle? They've got macular degeneration. How do I help them? Have a chat with them, talk to them, let them know that there is help out there. The MDF will also be your best friend in this area, and they'll be able to support you if you wanted to move on to the next step to learn how to start doing things or keep living your life. So please feel free to refer. So yep, it's a given that most of our referrals come from eye healthcare professionals, ophthalmologists, optometrists, orthoptists, and other medical professionals such as GPs. But don't ever be afraid to refer. You don't need to be a medical or a clinical person. If you see somebody is having issues, a grandparent, a partner, a friend, a family member, a neighbour, talk to them about Vision Australia and ask them, would you like me to refer you? Or you can pick up the phone and call them and somebody will be able to help you out. So don't ever let that be a barrier, thinking that you can't refer because you're not a medical person. When should you refer somebody? So if the person that you want to refer has a condition that's permanent and progressive, such as macular degeneration, I won't go into number 2, but if you've got somebody who's just lost their driver's license, so they're less than that 612 line that was the minimum for driving, that in itself can be very traumatic. So it's a really good time to start seeking help, especially if that's only the start of your disease and it's expected to get worse. Also, if your side vision is very constricted, before it gets too constricted, we like to see people so we can start therapy and introduce them to mobility exercises and training. If you think the person you want to refer is at risk, if you've seen burns on their hands or cuts on their fingers or bruises because they've fallen or tried to make a cup of tea and burnt their hand or tried to chop up that salad and chop the finger, really good time to talk about Vision Australia and refer them across where we can come in and help them. Also, mental health wise, if the person that you're worried about is a little bit down, is always expressing that they're having difficulty doing the things that they love to do, and that can be really debilitating. If there are things that I really love doing and can't do them anymore, my life becomes pretty futile. Like I just start to think, well, this is it, it's over. It's not over. We can help these people. So please keep a lookout for this area of issue that comes up with people who may have macular degeneration or other vision loss. If for no other reason, and as I mentioned to you in that previous slide, from the risks perspective, you've really got to be very careful around people, especially if they're living on their own. Their falls risk is going to increase. And as I've said a couple of times, they might become more isolated, which leads to depression. And we don't want that because there are ways of helping these people. So if for no other reason today and no other take-home message that you remember from this talk, it's please remember people are at greater risk of falling and becoming depressed when they have low vision. How do I do it? Really, really simple. The easiest way is to go online. If you have access to a computer, there's a button on our own homepage that says refer my patient here. You don't have to be a medical person, as I said, but it's just worded that way. Click on that, fill in as much detail as you can, and we will follow up with the patient or the client or your family member or your neighbor, whoever it is that's coming to us, and we'll start to work out what it is that their problems are and what it is their needs are and how we can actually help them and talk to them about that. So sometimes when you talk to people about Vision Australia, they might think, oh my God, this is going to cost me. I'm on a pension. I can't afford to be referred anywhere else. Please be rest assured, whether it's you or you want to refer somebody, we will sit down with you and work out the benefits that you may be entitled to through the National Disability Insurance Scheme or My Aged Care, and make sure that you have access to funding that you're entitled to because of your condition. So we'll do all of that for you. The other thing, I can't get there, I don't like catching buses, I've got no one to take me, I don't like getting into cars, we can come to you. So wherever you are, in a nursing home, at work, we actually can come to you. Our occupational therapist, our orthoptist, our orientation mobility specialist, adaptive technology specialists, they can all come to you, and that will be part of your package. So please don't let that either be a barrier. And as you can see there to the right, we have June, fantastic client of ours. She has macular degeneration and she's dancing. She's still ballroom dancing. So never say never. So with COVID, some of you might be afraid to seek help. Please rest assured that we're doing telemedicine, so we can actually talk to you and give you hints and advice online. We are seeing people face to face, especially here now in New South Wales with COVID easing a little bit. We do follow strict protocol and we do perform a risk assessment to make sure that you're safe and we're safe, so that if you do come into one of our offices or we do come out to see you, all those areas are covered and we make sure that everybody's not at risk. And if you come into our retail offices, only a certain amount of people can come in, and there's sanitisation stations everywhere. So please don't let COVID be another reason, even though it's a very important one, for you not seeking help. Even if it's just picking up the phone, we can help you. As I said, we're across Australia, so if you want to visit a loved one in a different state, you're moving, you live in a rural area, Vision Australia will get to you some way, shape or form. So we also do fly-in, fly-out services for people who may live regionally. We contract out with optometrists and occupational therapists in some country areas, and they see clients on our behalf, and then will tell us that there are quite a few. So our orientation mobility specialist or our orthoptist or occupational therapist will fly out and see these people. Of course, with COVID, that's sort of come to a bit of a lull at the moment, but it's definitely a service we can provide. So contacting us, contacting Vision Australia, the 1300 number, so 1300 847466, Monday to Friday, 8:30 a.m. to 5 p.m. You can fax us, email us at info@visionaustralia.org, or just go onto our website. There's lots and lots of information, www.visionaustralia.org, and you can look at things you want to buy from the shop, equipment, cost of things, more advice on eye disease. So fantastic resources there that are available, and we can actually send them out to you if you desire. Your other contact point, of course, is the Macular Disease Foundation. Fantastic support, and please call them for the expert advice, information and support that you'll need. And they'll also be able to talk to you about services such as Vision Australia, and they're 1-800-111-709. That's my reference list, just in case you thought I was talking gobbledygook. I assure you that it's all well-founded. And if you have any questions, I'm more than happy to take them. But please remember to give us a call or send us an email if you also want to do that. Thank you very much for listening.
Thanks so much for that, Nabill. That was extremely informative, and I think everybody that was listening learnt a lot from that. So thank you so much. So before I go on, I would like to quickly remind everyone how they can pop in some questions. So if you did have any questions about anything Nabill went through, again, you can click on that questions icon. That's a little question mark inside a speech bubble, and then it will bring up that white rectangle where you can pop in your question and then select send. As I mentioned before, only myself, Nabill, and an MDFA staff member can see those questions. So don't be afraid, there's no such thing as a silly question, just send those through. And please try to keep those questions quite general in nature if you can. Now I'll just quickly go over some information about the Macular Disease Foundation Australia. Our goal is to try and reduce the incidence and impact of macular disease, and we do this through our 4 major pillars. So our first pillar is prevention and early detection. So we provide current, accurate, ongoing information about macular diseases to the whole of Australia. Last year, we reached over 7,000 people, which we were quite proud of. Support and services. So we provide support for the entire macular community, and we also facilitate access to other support services such as Vision Australia. I'll talk a little bit about this later. Voice of the macular disease community. So we're very proud to try and advocate on behalf of the macular disease community. We try to design policies for state and federal government, and we also try to make sure that medical benefits are not cut. And finally, research and data. So 100% of funds donated to research go directly into our research grants program. Since 2011, we've actually given a massive $4.1 million to 21 different research projects. Now, this is how we can help you. So I know Nabill already went through this number as well. That is 1-800-111-709. It's not just a number if you're having IT problems with webinars, but it's a number that you can call for any sort of support that you might need regarding your macular disease. So if you want information about macular disease, such as age-related macular degeneration or diabetic eye disease, perhaps nutrition and supplements, you can call this number. If you want some extra information on my aged care or NDIS, again, you can call this number. If you prefer to send your question through an email, you can do that. That's at education@mdfoundation.com.au. If not, you can also visit our website, which is www.mdfoundation.com.au, and we have a whole host of resources there, and all of our resources are completely free, so you can order whatever you would like. Now, at the conclusion of this seminar, we will be sending through an email to all attendees. It should be in your inbox within about an hour or so. And inside that email, there'll be a link to a survey. And if everyone could fill out that survey, that would be really great because it gives us some feedback on how we can improve future webinars. A recording of this webinar will actually be available on our website as well for you to view, and there'll be a link for it in the email too. And speaking of future webinars, our next webinar will be on Thursday, the 12th of November from 2 to 3 p.m. Australian Daylight Saving Time, so Sydney time. And it will be about the toxic impact of sugar in society and the ravages of type 2 diabetes. And that's going to be presented by Australian of the Year, Dr. James Mukey. So that will be the next one. Now, if you would like, you can sign up for that through our website, or a link for that will be available in the email that you receive. If not, we've also just popped a QR code on the screen there, so you can just take your smart device and scan that, and it will take you straight to the registration link. Now, we do have quite a few questions coming through, so I might just ask Nabill to come back on the screen, and then he can help us go through those questions.
All right. Delina, you might have to read them. I can't see them.
Yes, no, I'll read them out, definitely. Yeah.
Fantastic.
Okay, so the first question is, I have difficulty putting on makeup. Do you have any tips to help that?
It would depend on the severity of your macular disease, if that's the problem with you, but I would recommend strongly a very large mirror, a magnifying mirror with perhaps very good lighting that's not too glary, so that the light doesn't sort of reflect back into your face, further stopping you from seeing that detail. Because we know that the side vision isn't as acute as your central vision that you may have lost. So it's very important to make sure that you're in the perfect environment with regard to that. So good lighting, good contrast, and a large mirror, I think will help you quite a bit there.
Next question is, I've heard about Bioptic driving being available in the US. Where can I access that training here in Australia?
Okay, so we don't deal with the Bioptics here at Vision Australia because we don't delve too much into driver training, but I do know that at the University of New South Wales, their lecturers there, I think her name is Donna, she covers that area. So if you want to touch base with the University of New South Wales and talk to them about Bioptics and driving, please feel free to do that.
Yeah, to the person that sent that question through, maybe we'll just send an email to you with a link to that as well, and then we can go from there. So I have low vision myself. What can I provide family members so they can help me?
All right, a really good thing to normally start doing is showing them exactly what it is that you see. So we can send out goggles, depending on what disease. We've got like paper goggles with a plastic sheet in front of them that simulate 5 main eye diseases. So depending on which one you've got, we could send you out a set of those, and you could show your family what it is that you actually see. Now, that's not going to mimic exactly what you're seeing. You may have it a lot more severe or a lot less severe, but at the end of the day, it'll show them what you can see at the same time can't see. So that's always a really big help when your family or your teacher, if you're a student at school, or a work colleague, or your manager at work, or anybody that you're with doesn't really understand your eye disease. Because often for somebody who's a fully sighted person, they just think glasses are going to help everything, and how can you see but not see at the same time? So that's probably the best way we can help you, to help your family understand, so that then they know how they can help you a lot better.
Yeah, I think that's a really great resource, those little plastic paper ones. Okay, so someone has asked, if I have trouble managing my iPad, can Vision Australia assist me with that?
Sorry, your
iPad.
Your iPad. Yes,
iPad,
definitely. Yeah. Our adaptive technology specialists will definitely be able to help you with that, and they're whizzes at it, and they'll sit beside you as long as it takes to help you be able to use that. But you still need to go through the normal referral process to ascertain all the fine details before that. But yeah, definitely something we do with our eyes closed, let me tell you.
Yeah. So someone has asked, what was the name of the camera on the glasses? I think they're referring to the AllCam there, perhaps.
Okay, so one's AllCam, so it's ORC for cat, AM for Mary. That's the one that sits on magnetically on any pair of glasses, so you can put the little magnetic clips on the arm of your glasses and it'll clip on, and it clips off, and it actually speaks to you. So it's got a little speaker, so if it recognizes somebody in the room coming into the room, it'll say Mary, Bob, Joe, and you actually pre-program those people in. Somebody with vision will pre-program them for you. And the other one was called Iris Vision, IRIS VISION, and they're both available at Vision Australia, and they're both funded by the NDIS and My Aged Care. So they're very, very expensive pieces of equipment. So rest assured that the government does fund them.
Okay. Oh, another question. Are there any fees for Vision Australia's services?
No. So Vision Australia is a charity, is a not-for-profit for purpose. So 50% of our funds come through donations and very, very generous people such as yourself. And the other 50% primarily comes through My Aged Care and the NDIS funding. Vision Australia never turns anybody away. Our heart is much bigger than our pocket. So never ever let funding be an issue for you to visit us if you've got problems. That's not what we're here for. We're here to help you. And there are always other, sometimes state-based or other funds or grants that we can work with to help you. And of course, some people are financially okay and they can self-fund if they don't want to seek support or services. But we don't generally charge a fee per se. The fees that we do charge will come under one of the schemes such as NDIS, My Aged Care, and then we charge a fee to that package.
Right. I think that follows up to the next question we have is, what if NDIS and My Aged Care don't cover the services or the support and aids that are needed? What if they're not covered by NDIS and My Aged Care? So that would be the state-based grants that you were speaking of.
All right, so it might be a state-based grant, it might be a Commonwealth Health Support Program. Just come on in and see us and we'll work out a way. Never say never with Vision Australia.
Perfect. Okay, another one. Oh, this question is, when is Melbourne Vision Australia reopening? I'm not sure if that's about a specific one.
They're having sort of meetings and we're slowly moving towards it. I don't think any dates have been set yet. We actually had some communication this morning. So we're hoping that'll be sooner rather than later. But as I mentioned, please feel free to still call us. We can still do some things over internet. So if you have internet connection, we can still do a telehealth consultation. And especially if you have somebody beside you who can help you, we can definitely start some strategies and get things into place for you. But unfortunately, the situation in Victoria is a lot more challenging than the rest of the country, because in Sydney we've opened, Brisbane's okay,
Another one. Hi, Nabill. Thank you so much for the webinar. Is it best to wait until you are assessed by My Aged Care and NDIS for funding, as some items can be a little bit more expensive?
Yeah, it's of course it's easier if you come to Vision Australia. So we're a My Aged Care provider, so we're on the My Aged Care portal. So you can be referred to us immediately by, if you've got a case manager or you're already on My Aged Care, they can refer you to Vision Australia, and we can access that funding and provide you services, and you become a client for vision related situation. With NDIS, it's more of a drawn out process. So you have to put a plan together. You have to get supporting documentation. Normally that needs to come from an eye specialist, not an optometrist, not a GP, not an orthoptist, but it has to come from an eye specialist, a doctor, to support. But any other letters you do get from those other people, such as your optometrist, orthoptist, or GP, do definitely go a long way in helping. But it often makes it a lot quicker if you've already got a plan in place and funding. But rest assured that if your vision condition is at a situation where you qualify for funding, we will definitely help you get it and make sure that you get the maximum amount as well.
Okay, this is a slightly similar question. Someone has said that they've made an appointment with their GP to apply for NDIS, but they're asking whether they should talk to Vision Australia first.
All right, it would depend on what services you're looking for. Are there other health issues or other issues that the NDIS package that you may receive or the funding you receive also be under the auspices or the charge of your GP? So you might need other things that are not vision related, and in that case, the GP is a good place to start. But if most of your problems are generally vision related, please feel free to give us a call and we can help start that process for you.
Perfect. And I think that this will be our last question. People always think that I'm rude or ignoring them because I don't wave back or see them. Do you have a suggestion for telling people about that?
I have a fantastic suggestion. I don't know where you are in Australia, but if you want to come into Vision Australia, we can give you a I have low vision badge to wear. And it's very neat. It's a very professional little badge. And a lot of our clients love it because it immediately sort of parts the seas, and people know that you can't see, so they will go that extra mile to make sure that you've seen them, perhaps introduce themselves when they come into a room, let you know that they've left the room. So all those things I know can be a real bugbear for people who don't see very well. So that badge alone can work wonders for you. So if you want one of those, please contact Vision Australia and we can make sure that you have access to one.
Perfect. All right. Well, I think that brings us to the end of our questions. Thank you so much, Nabill, for your presentation and for going through those questions as well. That was really great. So thank you so much.
Absolute pleasure. Thank you to the Macular Disease Foundation for having me. And guys, you do a fantastic job, and it's really a real pleasure to work in partnership with you guys because we know how much you actually help people as much as we do.
And I think we can say the same thing about Vision Australia. Everyone sings your praises because of exactly how much you help the community. So right back at you.
Fantastic, fantastic.
All right, thanks so much, Nabill. And thank you everybody as well for joining us for today's webinar. As I mentioned before, our next webinar will be on the 12th. That's a Thursday in November from 2 to 3 p.m. And that will be presented by Dr. James Meeke. So thanks everybody for joining us today, and we'll see you next time. Thanks. Bye.
Thank you.